The Asthma and Allergy Foundation of America St. Louis chapter serves those affected by asthma and allergies through education, support, and resources. Founded in 1981 with the intention of helping kids breathe, AAFA kicked off its services in the heart of St. Louis, providing underserved children with life-saving asthma and allergy medications, equipment, education, and support. This work continues today as the Breath program and allows kids and families served to lead lives without limits. AAFA expanded its work by addressing the needs of those diagnosed with food allergies. Children with food allergies are 2 to 4 times more likely to have asthma, by providing education and bringing people together in the community for food-safe events. Helping children in their homes has been critical, but it was also important for AAFA to address the same needs of children in their schools. AAFA was the leader in 2012 in helping Missouri become the first state to stock life-saving medication which could rescue a child who was having an asthma attack while at school. At this time, AAFA launched the Rescue program to ensure schools had the education and equipment that they needed. Because of AAFA's work, Missouri and the Rescue program became the country's first example of how a school-based asthma intervention program should work. Learning from this example, other states began to pass their own stock albuterol legislation. In 2018, Illinois joined Missouri, and the Rescue program began serving some southern Illinois schools as well. While continuing to serve children in their homes and at school, AAFA launched a new initiative called a Diagnosis Kit, providing resources and tools for both asthma and food allergies to kids in the most vulnerable area, so they had the most successful opportunities to move from diagnosis to control. In July 2022, AAFA made the conscious decision to grow its programs to help more children. Both the state of Missouri and Illinois became the first 2 states to fund the first school-based asthma intervention, launching Rescue into more than 5,000 schools in the 2 states. This is now the largest school-based asthma intervention in the country. With another 15 states across the country with legislation that allows albuterol in schools, AAFA has once again become the leader in school-based asthma care. By reducing asthmatic emergencies of children, this allows the states to save money and keeps children safe and in school and in their homes. At the core of everything we were doing was to simply help more kids breathe. While continuing to provide children and families with essential resources and education in schools, at home, and in the community, AAFA recognized that for 43 years we were continuously treating the same symptoms without ever changing the system. By having a larger footprint with Missouri and Illinois schools and the ability to communicate with school leaders, nurses, teachers, parents, and community members, AAFA can now learn from them to make better strategic decisions in the future and continue to build better systems and create bigger impact. Where are we going by 2031, our 50th anniversary? Rescue in as many places as we can support it and ready to implement it in new areas as the best-in-class model for the country. Breath, continuing to serve the region in even deeper and more impactful ways. Food allergies, programming elevates the knowledge of the community to be safer and food institutions to be more inclusive. Diagnosis kits, the most vulnerable children receiving resources upon diagnosis of asthma of food allergies with a diagnosis kit. AAFA as a thought leader and change maker in the space building on its own legacy of innovation.